Now, let's talk about the myth of taking natural testosterone versus testosterone hormone. I see this over and over where men think that they're doing the right thing and reaching for natural testosterone bottles and then showing up at the IVF clinic and having no sperm count.
Right. So first of all, there's no difference between natural testosterone and prescription testosterone. Testosterone is a molecule. It has a particular molecular structure, and there's no difference whether you are grinding up a bull's testicle and injecting that into your leg, or going to the pharmacy and picking up a vial of testosterone cypionate or testosterone enanthate. The cypionate and the enanthate are just sort of buffers that the testosterone is mixed with, but that testosterone molecule is the same no matter what the source is. Bioidentical hormones have been marketed very heavily for women, and there are instances where a bioidentical female hormone is in fact different than what was being used to treat her previously, but not so with testosterone. Now, testosterone is not all that expensive, and you don't have to spend lots of money for some special kind of natural testosterone. You can get prescription testosterone and feel very confident that that is the natural molecule. But what you have to be wary of is thinking that some kind of testosterone is going to promote your fertility, whereas other kinds of testosterone make your balls shrink. All testosterone makes your balls shrink. And the reason your balls shrink is because it's shutting off sperm production. And sperm production, the presence of sperm in the testicles, is the main thing that influences the size of the testicles. The testicles are predominantly filled with sperm producing tubes and sperm cells, and just a small percentage of the volume of the testicle is comprised of the cells that make testosterone. So when you take testosterone, whether it's an injection or a gel, whether it's natural testosterone or good old regular pharmacy testosterone, the testosterone in your bloodstream is going up to that good old pituitary gland that I mentioned, which is the control center for the production of testosterone. And it's telling the pituitary, hey, look, there's lots of testosterone in the blood. You can chill out. You don't need to send us any more signal right now. So as long as a guy is on testosterone from the outside and the pituitary is seeing that testosterone level, it's not going to send any signal down to the testicle to make testosterone, nor will it send any signal down in the testicle to make sperm, which is this other signal called follicle stimulating hormone, or FSH. And so without those signals, the testicles stop producing their own testosterone. Now, when the testicle produces its own testosterone and it gets into a man's bloodstream, and you measure that in a lab, you might see that the level is 400 or 500 or 600. But before it gets out of the testicle into the bloodstream, that testosterone is stimulating the sperm to grow. And the level of testosterone that the sperm see is 100 times higher than what the muscles and the brain and the penis sees. And unless you are injecting testosterone to bring your testosterone level up to 40,000, you're not giving your sperm enough testosterone to produce. And this is why when men go on testosterone, they stop producing sperm. And it doesn't matter what kind of testosterone it is, it always does this. So if a guy has low testosterone and he wants to preserve his fertility, or he's trying to have a baby, he should definitely not go on testosterone. But there are other ways to boost his testosterone, and those ways work through that signaling system from the pituitary. One of those ways is with the use of a pill called Clomid, or clomiphene citrate. Clomid tricks the pituitary into secreting more signal, and that higher level of signal can stimulate the testicles to produce even more testosterone than they normally would. Also, a man can use HCG injections, human choriogonadotrophic injections. These are injections that are a substitute for the luteinizing hormone that the pituitary produces. So they directly stimulate the testicle to produce more of their own testosterone. And when the testicle is producing its own testosterone, that sperm get that 100 times higher dose that they need. And then the blood gets the regular levels that the body requires as well.
Amazing. Just to clarify, so we don't scare any of our male audience members, if they did the HCG injections, these are not being injected in into their testicles, correct?
Correct. So any of these injections are just going under the skin or into the muscle to diffuse into the bloodstream and then reach the testicles or reach the pituitary gland and have their effect.
That's great. And we know from the women that we support at Fertility Answers that Clomid is a very affordable pill as well. So these are options that don't even, cost a $70 or $80 bottle of that's marketed as natural testosterone, right? And
but it's really important though that these kinds of medications, as well as testosterone, be administered under the supervision of a physician. There are many guys out there who have easy access to testosterone, sometimes through their trainers at the gym, online, friends, and that's not a good thing. And Clomid and HCG are not without risk, and they really should be prescribed under the supervision of a doctor, and routine monitoring of blood and physical exam is required as well.
100%. Why do you think it is that we are seeing so much of this in like younger and younger men? Do you think it really is driven by vanity because they're at the gym and they're trying to bulk up and somebody spreads misinformation about, hey, just take this natural testosterone supplement? Or do you think it's because they have an aversion to going into a urology appointment or having this conversation with their primary care doctor?
I think it's a combination of both. Low testosterone has become a thing in the media. People are talking about it now. And we saw a lot of ads on television about low T. And that was a good thing because there were many men who were suffering from low testosterone unnecessarily. But it also had an unintended consequence of scaring people into thinking, hey, maybe I have low T, because the symptoms of low T overlap also with just the symptoms of stress and fatigue. And it's not always low T that are causing the symptoms, but it can be. And I think there was a lot of media attention and a lot of advertising attention that stimulated a concern in a guy's mind. But then, like you said, guys are pretty hesitant to go in and see a doctor ever, much less talk about their sexual function or their strength, issues that they consider to be part of their identity and their pride, and don't necessarily like to admit that they're failing in those areas. And with the ability to get it somewhere else, online, in the gym, or some sort of testosterone clinic, but away from the traditional doctor, away from the attention of their parents or their spouse, I think that all kind of creates a perfect storm for this overuse and misuse of testosterone.